Good afternoon, one and everyone. I welcome you to the Indian Psychiatric Society Tamil Nadu Chapter Research Capacity Building Committee for a statewide journal club. And this is a once in a month affair that runs on every fourth Saturday to help us develop some capacity building in terms of understanding critical appraisal of an article and then certain things that skills that are required for not only for the postgraduate students in psychiatry but all the psychiatry practitioners in Tamil Nadu and around in Puducherry also. Now for this today's as a part of this capacity building, first of all, it is being run under the auspice of the current president, Dr. C. Sadananda, and his executive committee members. And also, it is backed by RCBC committee uh, with the following members: Manikantan, Vanishri, Dheeraj, Katula, Marmanatham, Divya, CR, and S. Sivaraman. We are thankful to the previous committee also, which has been very helpful in running the journal club lecture series successfully. That model was different and it was very successfully planned by Dr. S. Sivaraman. But it was 2 hours. We are now reduced it to 1 hour, very short one. Now we'll come to the current series. Now we will have today an understanding about critical appraisal and observation study. We have selected an article that is recently published in the Indian Journal of Psychiatry, which we have all circulated, and then we hope the audience have read it. And then myself, I'm Dr. Shivanand Kattivani. I'm a professor of psychiatry at JIPMER, Puducherry, and currently given the responsibility of running this RCBC once in a month, that's every fourth Saturday, along with my team. This journal article will be presented by Dr. Farhan, who is a final year PG student at Psychiatry JIPMER, Puducherry. Over to Dr. Farhan for journal presentation.
Thank you, sir. I will be sharing my slides now. Is the slide visible?
Not yet. It's coming as yeah, now visible. Yeah. You can run in the full slide mode and then yeah, this is fine.
Okay. So good afternoon, everyone. Today I'll be presenting the statewide journal club. Myself Farhan, doing final year residency and Department of Psychiatry in Chennai. So initially, to speak about the journal, Indian Journal of Psychiatry was established in 1949 and it's the official journal of Indian Psychiatric Society. It's published on a monthly basis and the current editor-in-chief is Dr. Sujit Sarkar, and the journal has an impact factor of 2. The article selected for today's discussion is titled An Exploration of Perspective of Knowledge, Attitude and Help-Seeking Behavior in Pregnant Women and Their Families Towards Psychiatric Ailments in a Primary Healthcare Setting in South India, a cross-sectional study. The primary investigator is Nandana S. Now, to introduce the topic, mental illness actually affects 25% of the global population, with India having a prevalence rate of around 10.6%. And negative attitude towards psychiatric illness are attributed to inaccurate information, limited contact with those with mental illness, and low awareness. In pregnancy, physiological and emotional transitions may act as contributing factors to mental health vulnerability. And studies show that around 10 to 16% of pregnant women and 13 to 20% of postpartum women experience mental disorders. And when family members understand the signs, symptoms, and impacts of mental health issues, they can offer effective support and intervention. And with this introduction, the aim of the study is to ascertain the knowledge gap, attitudes towards mental illness, as well as mental health seeking behaviors in pregnant women and their families. Now, the study was a cross-sectional study with the setting being a single primary health center in Bangalore. And the population studied was antenatal mothers and their family members. They followed a consecutive sampling, and the inclusion criteria was individuals aged over 18 years of age who are visiting the PHC for antenatal checkups along with their family members. Exclusion criteria was intellectual disability And for the study, institutional ethics committee approval was obtained. Now, there are three scales used in the study. First one is mental health seeking attitude scale, which follows a Likert scale. And the primary question asked is, if I had a mental health concern, seeking help from a mental health professional would be, and then there are multiple items on which the patient have to score. This is a self-rated scale. And the interpretation of the score in the study is given as the behavior would be termed favorable behavior if the score would be above the mean score of the sample. Now, to explain this, let's take the example of around 10 to 15 patients, and calculating all the scores and calculating the mean score of them, assume it to be around 10. Now, this for the mean score is 10 currently. And for an individual patient, if the score is above the mean, let's say 12 or 15, then that would mean that they have a favorable behavior. And if their individual patient score is less than 10, that is less than the mean, then it would be unfavorable behavior. This is how the scale was explained in the study. The second is second scale is used to assess at a community level, especially with regards to stigma. And there are around 12 items in this, again in a Likert format, from ranging from agree strongly to disagree strongly. The minimum score is 1 and the maximum score is 5 for each of the item. And in a similar fashion like previous scale, the result is interpreted as favorable behavior if the score is above mean score of the sample. Now, the next and the final scale is mental health knowledge scale, and there are 12 items in this, again in a Likert score of 1 to 5. And the interpretation would be that it would be considered that the patient is having good knowledge if the score is above the mean score of the whole sample who underwent the screening or the application of the scale. With regards to statistical analysis, SPSS software was used with the mean, standard deviation, frequency, and percentage used for descriptive description. For categorical variables, chi-square was used, and for continuous data, students t-test and one-way ANOVA was used. And association between knowledge, attitude, and help-seeking behaviors was analyzed by Pearson correlation and linear regression. A p-value of less than 0.05 was considered as statistically significant.
Okay, before this, I would like to take are there any questions related to introduction part, objectives, or methodology part? Are there any questions? We'll wait for a few questions. Then otherwise, then we'll move to the results. We're not going to call back college wise. Anybody who has a doubt and ask their questions. Introduce yourself and ask your question. Any doubts regarding the methodology, scales, introduction, rational? Okay, there seems to be no question. Then go ahead with the results.
Moving on to result, like in India, any other study, table 1 corresponds to the socio-demographic details of the participants in the study. So you can see there are two groups, pregnant women and family members, and baseline socio-demographic details were compared. Age, education, religion, occupation, socioeconomic status, and gravida for the pregnant woman. Now, the comparison revealed that there was significant difference with respect to age and occupation, where family members were significantly older than the pregnant woman. And with regards to occupation, predominantly the pregnant woman, majority of them were housewives, unlike the family members, in which only around 44% was belonging to the occupation of housewife. So to summarize this result, Total participants were 230, out of which 100 were pregnant women and 130 were family members. The average age, the mean age of pregnant women was 26.2 and of family members were 40.6. Majority of them had school level education, which was classified as education from first standard to 12th standard. And predominantly they were following Hindu religion, and most of the pregnant women were housewives. And both primary gravida and second gravida were equally distributed, amounting to around 38% each. Now, this was a semi-structured questionnaire that was applied. In this, you can find that there are 5 questions. First one is about awareness of any mental illness related to pregnancy. Second is about premenstrual symptoms, including irritability, mood swings, and crying spells. The third one is about depression, where sad, being anxious, poor sleep for more than 2 weeks. And fourth one is about psychotic symptoms, where speaking irrelevantly, fearful, believe that people may harm the patient. All these were asked. And the last one is about postmenopausal symptoms. And for all of these 5 questions, a categorical options were given as yes or no. And the study found that there was no statistically significant response when comparing both pregnant women and family members. There was no statistically significant difference between both the groups. And the result showed that nearly 93% of pregnant women and family members lacked awareness of mental health issues linked to pregnancy, childbirth, and menstruation. Around 85 to 90% perceived mood swings, irritability, crying spells, and bloating as normal premenstrual symptoms. Around 78% of pregnant women and 61% of family members, that's more than half and nearly 3 by 4 in the pregnant woman, thought that sadness, anxiety, and poor sleep for more than 2 weeks after childbirth were normal, and around 80% identified psychotic symptoms as clearly abnormal. So, generally, there is a low awareness, but there is some recognition of these severe psychiatric symptoms, especially psychotic symptoms. Now, the next shows the student t-test and ANOVA result of the 3 scales. Now, in the table, you can see there are 3 sets of variables under which the scales have been analyzed. First one is age, in which there are 3 groups. Second one is education, in which again there are 3 groups. And the third one is socioeconomic status, under which there are 5 groups. Now, under each of these variables, each of the scales have been looked at and checked whether there was any variance among the groups or not. So if you look at the table and see, you can find that both for age and socioeconomic status, there was no significant finding. However, in the education variable, all of the scales had significant difference in the group. Now, the previous one was in the pregnant woman, and this table is among the family members. Again, a similar analysis was done under the 3 variables, looking at each of the 3 scales. Now, among the family members also, they found significant difference only under the variable of education in all the scales. So, the analysis showed that there was no significant difference in knowledge, attitude, or help seeking across age or socioeconomic groups. However, higher education was consistently linked with better mental health knowledge, more positive community attitudes, and more willingness to seek professional help. Now, this result suggests that education is a key factor influencing awareness and mental health behaviors. Now, after the correlation analysis, they've reported that in pregnant women, knowledge and attitude showed a weak but significant positive correlation with a p-value of less than 0.05. However, with regards to other correlation analysis done, which was among family members, comparing knowledge and attitude, whether it was attitude and help-seeking correlation, and between other groups, all this they found that the result was not significant. However, they have commented that it was weakly positive. So under discussion, Pregnancy can be stressful due to psychological, social, and emotional and physical changes. Reports of mental health problems in pregnancy are increasing, and psychological problems in pregnancy are especially common in developing countries. Now, these are attributed mostly due to lack of awareness, limited services, and cultural practices. Another study in rural South India showed that around 85% of mothers were unaware of mental illness, and around 97.3% of physicians did not ask about mental health symptoms. Now, this study found that participants with higher education had better scores in mental health knowledge, attitudes, both among pregnant women and family members. The study shows that better mental health literacy is linked to supportive attitudes and reduced stigma. So, improving mental health literacy in families can actually lead to positive attitude, better help seeking, and subsequently improved maternal outcomes. Now, the limitations reported in the study are that it had a small sample size and the recruitment was from a single PHC, which can limit the generalizability of the results of the study. So, poor awareness of mental health problems among pregnant women and family members were found, and the reasons were low level of education, lower economic status, cultural beliefs, lack of mental health services, and stigma. And they report that enhancing mental health literacy through various means can increase the positive attitude and help seeking behavior in both pregnant women and family members. Future research focusing on larger, more diverse samples can enhance the generalizability of the results. Some quick questions. The first question is, according to study, what percentage of pregnant women and their family members lacked awareness about mental health issues related to pregnancy, childbirth, and the menstrual cycle? If it's possible, some of you can answer in the chat box.
Yes, they can write their answer in the chat box. No, yeah, move to the next slide. You are showing the answer.
That is a mistake, sir.
Okay then. So 90% didn't have a knowledge that it is a mental illness. Go to the next question and wait for somebody to put in the chat box some answers.
Yes, sir. Yes, sir. The next question is, which of the following factors was significantly associated with better mental health knowledge, positive attitudes, and improved health-seeking behaviors among participants? Age of the participants, religion, education level, and socioeconomic status.
Yeah, please put your answer in the chat box. Yeah, now I'm getting some answers. Yeah, this Dr. Shushda said C answers, education, socioeconomic. D, socioeconomic. Dr. Sadanand sir has written, Sindhana has written C. Yeah, somebody from East West Pharma is also participating. Good. Mantri Kumar C answer. See, one person has reported a D as the answer. Most of the majority are saying C is the answer. Okay, you can show the answer now.
The answer is C, educational level. Next question. Which of the following strategies was recommended by the study to improve mental health literacy among pregnant women and their families? Option A, increasing medication availability at PSCs. B, use of adult learning methods like awareness videos, flip charts, and brochures. C, mandatory psychiatric consultation for all antenatal women. And D, exclusive training of obstetricians in psychiatry.
Please type your answer in the chat box. Now I'm getting the answers. Answers are B, C, and B. Both C and B are they are given. Okay. So most of them have said B, and some have said C and B both. Okay, you can show the answer.
The answer is B.
Before we move to the critic, so this entire discussion is about how to critic an published article. We come across that people are there where we see that article is very difficult to understand. That's the first part. When you read it, you are able to understand. Then you have to find what are the strengths and limitations of this article. We have chosen a simple article. We have nothing conflict of interest. Why we chose this article? We chose this because it is simple one, simple observational study, and it just lasted 4 pages, and it's easy to read. And we also chose it because it is applicable to our population and it is done in our neighborhood. So that is the reason why you chose this, to understand, make a evaluation of this study article. So are there any questions related to this article? Anybody wants to say their critic also? Strengths and limitations? Even PG psychiatry, faculty, staff, or even senior psychiatrists can also participate. Give them 2 minutes.
Okay.
Good afternoon, sir.
Yes, please go ahead.
Yes, sir. Myself, Dr. Priyanandini from Institute of Mental Health, sir.
Yes, tell me.
Yes, sir. So the study shed light on poor awareness and stigma towards mental illness in pregnancy, especially the population covered lower educated populations. So I would like to add on a few discussion points, sir. Like, for
Yes.
example, among the family members' role was mentioned. So, particularly who had a greater influence among them, like whether it was husbands, because usually in such population, like male dominance can be there. So they might not come and express among them, like to the doctors. So such whether such stratifying those things might give stronger insights. I wanted to have that doubt, sir. And also the psychiatric morbidity that was associated was actually not screened in participants. So that also I wanted to add a point, sir.
Yeah, fine.
Yes, sir.
Farhan, you have anything to say about this thing?
Yeah, with regards to the first question, you have any other question, ma'am?
No, sir. So, like maybe future implications, we may like for example, to see a longitudinal follow up, to see if actually it may improve outcomes, like awareness interventions. If we give, how is the outcome? Maybe in future we can have such study in future, sir. That I wanted to add.
Yeah,
Thank
sure.
thank
Thank
you
you.
for your questions, ma'am. With
Thank
regards
you,
to the
sir.
first question, with
Yes,
regards
sir.
to stratification of the family members, it's a well taken question. In the study, they
Mhm.
have actually not stratified the family members. So, for instance, if a distant cousin comes as family members, would they still include them as family members? Because, like you said, if it was a close
Yes, sir.
person, if it was a husband, if it was mother, there would be some kind of variation, and that actually can give more insights with regards to awareness and other
Yes, sir.
scales being used. So that is definitely one of the limitation of the study. You can put it that way. And in the future, if some other studies are planned, that idea of stratification can be used.
Yes, sir.
And with regards to future implications in the study, definitely, like you told, this actually gives an idea of what the current basic issue is. And then on, you can try these interventional studies that you talked about, like giving awareness and then following them up and seeing whether reapplying these scales and whether there would be decrease in the issues that were recorded in the current study, that can be looked up to in a kind of interventional study. which has its own merits.
Thank you so much, sir.
Yeah, there are two questions, just I will define it. They should have taken ideally, they didn't mention it actually, with a family, a pregnant woman and their corresponding family member. No, it is not though. They have taken two groups. One is a pregnant woman and other is the approach to a different group, that different group is family members. That is why it is not matched actually. And second thing, you said that mental illness morbidity was not assessed. Yes, correct. They are not assessed. The focus was not on mental morbidity assessment. Any other questions? Okay then, Paran, can you go to the critic, your critic, how you are critic this article?
Okay, sir. So there are multiple tools available for critical appraisal of cross-sectional study. The one that I've used is Newcastle Ottawa scale, which was an adapted form for cross-sectional study. So this this scale actually uses 8 sub categories, and they are scored by stars, meaning out of 9 stars, how much stars does the study actually get, and based on that you give a final conclusion on how efficiently the study have been done. So with regards to representativeness of the cases, I've kept as somewhat representative because they had taken from the PHC in the state. However, the why I have not given truly representative is because they chose only one single PHC, which may not represent the whole of the population that they wanted to generalize the result to. The second variable is sample size, where whether it's less than 400 or more than 400, and that I've given as 0. And the third one is non-response rate, which is actually not clear, meaning if the scales were applied, how much of them responded to the scales, and if they did not respond, what was the issue. So details on that is actually not given in the study. With regards to the tool applied, they were described as the tools were validated. Now the issue in this is the tools can be tools can be validated in general, but if you're applying it for a population with a particular language that they're following, then usually these tools have to be validated in the particular language too. Now whether this was self-rated or whether the primary investigator applied it, whether it was validated in the language, all these details are not clear in the study. Hence, I've given as 0. With regards to confounders, they've not reported of any confounder. The only one confounder that they, in a way, portrayed is they've excluded patients with IDD. With regards to outcome, this outcome was self-reported, and hence I've given as 0. And statistical test, they've used the appropriate statistical test and they've described the statistical test. Hence, I've given as 1. So overall, the study would get 4 stars out of 9. Now, this is again giving a benefit of a doubt. They've just given the statement that scales were validated. So if it were actually validated in the language, then they would acquire 4 stars. Now, if it was not, then they would only get 2 stars out of 9. Now, some of the other critics was again the question, were any language speaking participant allowed? Now, this was in Bangalore. Now, there would be patients who are speaking other than Kannada language, and were they also allowed? And if yes, then were these scales validated in those languages also? And for the semi questionnaire, they've used a categorical yes or no questions. Now, the issue with this is usually the patients would have some knowledge, at least in some of the cases, and those kind of variations in the knowledge is actually missed out if we use categorical questions as yes or no, which is why in most of the scales you can see that all of them uses a Likert scale, from knowing doesn't know anything, knowing something, and then knowing most of it. So in that manner. And the third one is that administrators of the questionnaire, who were they? The details are not given. This is especially important because if they were PHC employed, if they were people employed in the PHC, then that can introduce some bias. So for instance, a patient comes and the same treating doctor is also applying the questionnaire, then there would be bias. Patient would tell answers more appropriately, so giving socially and acceptable answers so that they would get treatment. So that can introduce bias. And like I said, validation of the scales in language is actually not mentioned. With regards to statistical analysis, they've used Pearson linear regression. Now, this is the Pearson correlation is used when the continuous data is normally distributed. Now, you have to check whether the data is normally distributed during using particular other test. So that test for normality was not done in the study, and a sub-analysis after ANOVA would actually yield clear association. So to explain this, if there are more than two groups under a variable, so here for let's say for education, there were illiterate 1 to 12 and more than 12. So if there are these three groups, what ANOVA does is they look at all of the group and find out that there is some variation between each of the group. That's it. So once you identify that there is some variation, then you have to look at which groups varied, whether it was illiterate and 1 to 12, or whether it is 1 to 12 or graduate. So within the three or more groups, where does the actual variation lie? So that have to be done using a sub-analysis, which was not done, which cannot be termed as a limitation of the study, but if done, could give more clearer idea. With regards to result, the Pearson linear regression table was not given in the study, and student t-test was not used, though it was mentioned, because in the analysis, all of them had three groups. Now, student t-test is only used when there are two groups. And in the result section, at many places, they've commented that there was a very weak positive correlation, however, not significant. Now, if you try to explain statements like that, it can introduce some bias into the reader, because the result is not significant. However, when you term it as very weak positive correlation, then they would actually think that it is something that is actually positive. That's it with my critiques, sir.
Yeah. Thank you. So are there anything else you want to add? Anybody from MMC, Stanley, KMC? Anybody from Changalpat Medical College, CMC Vellore, SCAR, Salem Medical College, RMMCH, PMS, SMEH, SLIMS, MGMCRI, AVMC, SRM Trichy, Dhanalakshmi Srinivasan Perambalur. Anybody from SRM Kataklantur, SRMC Porur, Karpaga Vinayaka, Savita Medical College, Chettinad, Meenakshi, Balaji, PSG, Mada, Tanjavur Medical College, Trichy, Tirunelveli, Coimbatore, Theni. Anybody from SRM Medical College, Katangalur, Monisha, Arunil, and Vanusri? Anybody wants to add anything? I am at Chennai. Okay. So what is the next one?
There's some points on
Impact factor. You want to cover what is the main gap impact factor? Yeah, go ahead, please.
Yeah. So I'll just describe some of the points that was mentioned in the study. First one is briefly about impact factor. So this is an index that reflects the average number of citations received by articles published in a journal during previous 2 years. So now this is calculated by dividing the number of citations in a given year to papers published in the previous 2 years by total number of citable articles published in those 2 years. Now, this is actually used as a proxy for a journal quality or influence, meaning if there is a higher impact factor, it's a proxy marker for a higher journal quality. Again, this has been criticized for being subject to manipulation, because there could be articles that are self-cited, there would be review articles which can actually boost the counts, and the impact factor can have field-to-field variability. So there are other alternative markers or indexes used other than impact factor. They are H-index, site score, Almetrics, and etc., which are currently increasingly being used. Now, next is the student's t-test, which is a statistical test used to compare the means of two groups. Now, the independent t-test is used when it is between two groups, and paired t-test is used when the same group is measured twice.
Yeah,
Now,
hold
is
on,
that
Paran, hold on.
Yes.
Before this, I think PG students should know that the variables are those which we are measuring. We need to define them as either categorical or continuous or ordinal, they say, but it is enough to know whether they are continuous or categorical. One example is age. Age, when you take their age as it is and then you find out their average and present as mean and standard deviation, now the age is considered as a continuous variable, because continuous variables are always presented with the mean and standard deviation. However, in this study, the age has been taken as categorical or continuous. It is taken as a categorical because they have divided the age into three groups. So in these three groups, when you present any age groups, you just only have to present as number and frequency. In each age group, how many persons are there, what percentage they amount to the total sample in that. So the categorical, the variables will always presented as n and percentage, that is number and then percentage of the total. This is a categorical. So these are these are basic things that are required to be know what are the variables, whether continuous or categorical. And in case this is only description, when you know that the this continuous variables are there, you want to find any association, find a difference, find a correlation, anything, it is a mandatory that this continuous variable should be checked whether it is a normal distribution having or non-normal distribution. And there are tests in a statistical test to know, or by bar graph also, by the distribution of the variables, you know whether this continuous variable is normally distributed or not normally distributed. Based on this distribution, we have a different statistical tests. So that's what now you have come to say, I think. So now you go ahead. When do you do students test?
So you use it when you compare the means of two groups, and the independent t-test is used when you compare two groups, and you used paired t-test when you compare the same group twice. So paired, for instance, if there is a set of students and before intervention you are getting a value, and the same student you are doing some intervention, let's say you're giving some medication for headache, and then after a period of time you are measuring the same group for the same outcome of headache. So it's the same group that is measured twice. So in instances like this, you use paired t-test. Now, like sir said, it is important to check for the normality of the data that is taken. So this student t-test and the paired t-test are used when the data is normally distributed. Now the data is represented as t-value and p-value to test whether the difference is statistically significant or not. Now this test is actually useful for very small sample size, provided the assumptions of normal distribution is met. The next is analysis of variance, which is kind of an extension of the student t-test. Now, if there are three or more groups to compare the means, then you use this analysis of variance. Now, this tests that whether there are statistically significant difference in the group means by analyzing between groups versus within group variance. The main output is represented as F statistics. It was T statistics in the student t-test. Here it's F statistics. And again, the normality of the distribution should be checked for. And like I said, like I said in the critique, that after analysis of variance is done, you should do a post hoc test, which are needed to identify which groups actually differed. So let's say there are 10 groups which you want to analyze. So instead of using t-test for each groups. You're taking group 1 and group 2 and checking whether difference. Then you're taking group 2 and group 3 and checking whether there is a difference. So if you do like that, then you would have to do multiple amount of tests to look for any difference between the 10 groups. Now, each of the time you do a test, there is a chance of error. So you have to do multiple amount of t-test. So that means there would be very increased amount of error. So instead of that, you use analysis of variance. So you compile all the 10 groups and you check whether any kind of difference is there among the groups as a whole or not. If it's not there, you can just keep them aside. But if it's there, then you do a post-hoc test. Because first step is you analyze that there is some difference within the 10 groups. Then now you closely look which groups differ. So that is how analysis of variance is done. Now this is a table explaining different quality assessment tools for observational study. There is Axis, there is JBI, there is NIH, there is Newcastle Ottawa, there is Strobe, there is CASP, and there is Minus. So the one I've used here is Newcastle Ottawa, which has a star system scoring from 0 to 9, and this have been widely recognized. Thank you.
Okay. Now, are there any other doubts and questions related to this critical appraisal? We have still another 15 minutes to go. Anybody has any doubts, questions, comments? You are welcome to say or put. You can put, if you are not, you have a poor connectivity, you can put in the chat box also. We'll take up. Anybody has anything to say? So first of all, I congratulate Nandara and the group for having their article or research published in the Indian Journal of Psychiatry. It is one of the top journal in India with impact factor up to. And you know that any article or research to be published, at least we have to spend 2 to 3 years. And then usually most of them will be a thesis product, I believe, probably, that has been come up and then presented. But apart from this, the scale that are there, they use it as a structured and semi-structured questions to raise the quality of observational studies. The Dr. Paran used a star-based rating. It's called as modified Newcastle Ottawa scale. However, when you submit an article to an submission to a journal, they usually take for review and everything 3 to 4 months, and they will usually ask you to follow what is known as a strobe. This is a strengthening and reporting of observation studies in epidemiology. So that everybody reports the same way, same under the same heading. So they make sure that you follow what is known as a strobe. That's what most of the journals will ask you to write according to this strobe checklist. And they will ask you to confirm that you have checked the strobe checklist while submitting this manuscript, which are called as observational studies. In this observational studies, we will only describe an event or describe a factor, and sometimes we do also analysis between them. It's called as inferential statistics. Only when you describe prevalence and other things, they're called as only descriptive statistics. But when you're trying to find whether it's correlated, whether it is associated, whether there is a difference in these cross-section studies, it becomes what is known as inferential statistics. When I went through other things, because I'm at a different level than my Dr. Farhan, who is a PG. So what I found was that in the introduction part, the rationale why they wanted to do the study was not very clear. whether they wanted to assess the stigma, whether they wanted to pour awareness, whether they wanted to know this thing. Though they have mentioned very clearly objective that they wanted to know the knowledge, attitude, and help-seeking behavior. And this they wanted to see in two groups. One is the pregnant woman, and another one is those with the family members group separate. They're not their relatives, need not be relatives. So that is why there is a number is not matching. The numbers are different. 113 and this was I think 100 I think the pregnant woman. The semi-structured I thought it is a strength, but they should have made. I agree with Dr. Farhan. They should have made as how much knowledge is not yes or no. Some people know it's partial also. And they should have given sample size calculation for this study because 230, how much is the sample size, Dr. Farhan? 230, I believe. I think it's a large number, I believe. Then they should have reduced the sample size. But if they say take a sample size less, then you may not find any some significant findings. So there has to be rational and why they decided on this such a sample size. And it's about the scales, he is right. Dr. Farhan said that the scales for assessing knowledge, attitude, and help-seeking behavior, there are different scales are there. We have to, the authors have to justify why they selected these scales. And there can be as much as possible, we have to go for a single scale as much as possible. There are many stigma scales are there. There are many mental health literacy scales are there. There are many also pathways of help seeking care are also there. So they have to give why they selected on these scales and why three scales. And if you check each scale, whatever they choose should be available or validated in the area where they have been using it. I saw that out of the three, I think one I'm sure is developed in Canada, and I'm sure these are all in English. So when you use it in English speaking population, it is fine. But still, our English, so called as Indian English, is different from what is the Canadian American English people speak. So terms mean different. Same term in English may mean different meaning in a different cultures and nations. So I'm sure this would be done in a Kannada, which is the local language in Karnataka. There could be others. They should specify that we administer this scale only those speaking in English or in the local language Kannada. Then when Kannada, they cannot use the English scale and translate into using Google or anything into Kannada and then use it. It has to be adapted and validated in the local language. Usually when a scale is published, they publish what is known as a property of the scale, which is known as psychometry or reliability and validity of a scale. Only those having a good reliability and validity and which are applicable to the local population should be used. And ethics committees would ask you to take a permission from the original author of those scales to use it for your purpose. Usually anybody who has developed a scale, because development of a scale is a research itself, maybe at a PhD level, up to the PhD level. So when they have developed a scale, usually either they keep it for selling or sometimes they allow you to use it and are free to use. But they strictly tell that you cannot modify and change the sentences or wordings because it will give a different meaning. So that way they are very careful that their scale is not modified, not used, not interpreted differently than what they are saying. So their permission is required. In short, ethics committees definitely ask that before using scales, take a permission from the original authors or those who have developed the scales. So that's how it has to be there. Three scales are there. Three are merely assessing a different domains, but they whether they're valid or reliable to be used in India. Even if the author say that yes, these scales have been used recently or previously in Karnataka or for similar studies in anywhere in India, that is also acceptable. Then wordings could have been used. Statistics, they should elaborate actually. They should say that continuous variables like so and so, like scales, were presented as mean and standard deviation, and categorical variables like age were presented as number and percentage. That's how they should present it. And also they should say where they did the t-test, where they did the ANOVA test, and where they did the correlation test. They should say for correlation test, we compared between the knowledge score and the age, if they're used as continuous. So they should use a continuous variables, and they compared knowledge between attitude and help-seeking behavior, which are all continuous variables, among themselves, and they found somewhere Pearson correlation they use. Pearson correlation R is used only when these continuous variables are proven to be of normal distribution. That is Dr. Farhan also has highlighted. They did comment that linear regression was used, but we don't see its use in the results part. Linear regression says what is the relationship between that variables and also how much each unit change can predict the change in the outcome. So those are called as linear regression models. Those stated, but they are not used. If students t-test used when they compare between the two continuous variable among the two groups. When it is continuous variables are compared between three groups, it becomes ANOVA for a normal distributed. Otherwise, it will become a Mann-Whitney-U test and Kruskal-Wallis test. These are the names of the tests for a non-normal distributed between two groups and between three groups for a non-normal distributed variables. The article should also end by future, which is a nearby, and then yeah, you want to show this? Okay. Yeah, please go ahead.
Sir, I just wanted to show this image.
Yes.
This actually summarizes what tests are used in what conditions. So you can just read through. You can find one-way ANOVA here. You can find paired t-test here. And among the nomenclature of regression, you can find that linear regression for continuous dependent variable. It's present here. And for correlation test, in the third image, you can find that Pearson correlation is used for parametric continuous variables. So this is where normality is checked for. If they are normal, it's termed parametric continuous, and if they're not normal, not following a normal distribution, then it's termed non-parametric continuous variables.
Okay, so there will be, you will find Google it, you will find it at what category, what statistical test to be used for what purpose, any flow diagram. So you will find it useful. Maybe you can take this as also a screenshot of this and save it. Right, then any other questions, any doubts? So start the reading an article. First of all, again, I'll highlight that if you want to practice critical analysis, don't be just appreciate and then congratulate them, but read in depth, in detail, and read those articles which are relevant for our population, which can be done in our population, so that we can be easily relate with that and find out whether there are any faults or not. It's not just about faults, but beyond that, you also need to know statistical skills and interpreting results. So, as Dr. Farhan said, a weak for correlation was positive correlation was found, however, not significant. It has no meaning actually. When only p-value is not less than 0.05, it has no meaning. There is no need to mention those things. It will only divert or dilute the results findings. So you should keep reading articles and also keep discussing in a group and in academia, so that you can improve your critical analyzing skills. So I'll wait for another 2 minutes if you have anything comments or anything last. And next month, October, we are going to have a case report about how to write a case report for a journal. So interested people can join that in the next month, last week of last fourth probably Saturday of the next month of October. So about choosing the best questionnaire, I think only one person has asked questions and they were right. Only I think it will go to Dr. Priya Nandini, I think. Priya Nandini from IMH.
Yes,
Is
sir.
that correct? Yeah.
Yes, sir. Yes, sir.
Yeah. You please share your name and phone number, correct name, so we will, so that we can issue your certificate.
I'm very honored to have this opportunity to present the presentation, sir, and looking at the article and reviewing it. It was a learning experience for me, and I thank for the platform and for the questions asked in the platforms. Thank you.
Yeah. So once again, I thank TN Tamil Nadu chapter of IPS, the President Dr. C. Sadanand and the Executive Committee team, and also my team members of the RCBC for this opportunity. And also I thank all those people who made it to this journal club for discussion. So we will see you next month and the fourth Saturday of October 2025. So we will take a goodbye, I think. Wish you all a good day. Thank you.